Hello, I'm Irene Tansman, author of Avi and Arlene's Autism War. Welcome to my YouTube channel. Today I'm excited to interview Dr. Patrick McGreevy. Dr. McGreevy is a board-certified behavior analyst with over 30 years experience with children and adults of all ages with developmental disabilities. He has served as a functional life skills consultant to school districts, residential programs, and private schools in North America and Western Europe. In 2000, he was part of the first group of board-certified behavior analysts. He directs a clinic in Orlando, Florida, and serves as an assistant professor in the Applied Behavior Analysis program at the Florida Institute of Technology. He is the first author of The Essential for Living, a functional life skills curriculum assessment and professional practitioner's handbook for children and adults with moderate to severe disabilities. Welcome to my channel, Dr. McGreevy.
Thank you. It's nice to be here.
Dr. McGreevy, for our viewers, could you briefly describe the Essential for Living curriculum and the Essential 8, and describe how the Essential for Living and the Essential 8 assessment and curriculum can help individuals with moderate to severe disabilities?
Certainly, it is what people would call a functional life skills curriculum, including teaching procedures. And it's designed for individuals specifically with more limited repertoires. So that could be a number of people with autism. It could be people with other sorts of pervasive developmental disabilities like Down syndrome and many other even more severe and complex disabilities than that.
Excuse me.
No, sorry,
are there any other curriculums like this, and what sets this particular curriculum apart from the others?
It has similarities to other life skills curricula that have been around for a while, the more recent versions would be there's the what's called the AFLS, and then the other one I'm trying to hold on a second. Trying to remember the name of it right at the moment. Just a second. I think I have a copy of it right here. Yeah. The Functional Independent Skills Handbook. The acronym is FISH. And these are our checklist type curricula. What differentiates ours is that it's a little more in depth. It goes into what really, serious functional skills are as opposed to what they appear to be. And then also it goes to children with severe and multiple disabilities, which the other curricula do not.
The Essential for Living curricula describes replacing problem behaviors such as severe disruptive, destructive, aggressive, and self-injurious behavior with targeted adaptive skills listed in the Essential 8. What evidence do you have that targeting the Essential 8 skills will reduce or eradicate these types of behavior?
Good question. There is plenty of literature in the field of behavior analysis to support all of the Essential 8. Basically, what they are is it doesn't just focus on the function of problem behavior, which behavior analysis has done quite eloquently, but it talks about what skills are missing. So if we say in a functional assessment that somebody's problem behavior is a function of demands, well, that doesn't tell you what skills are missing. So all we did is we took the skills that tend to be missing when the function is demand and other functions, and that's what became the Essential 8.
So a lot of behavioral schools, they just, if the maladaptive behavior occurs in a lot of behavioral programs, they treat the behavior directly. In other words, there's some kind of punishment as a result of the individual having a behavior. How do you know that teaching these missing skills is a better option than just treating the behavior with punishments?
Well, see, I would argue that we do treat the behavior directly, but at least we should be treating it directly. We are taking a look at what's missing in a person's life and just saying, listen, if you had those skills, would you have the problem behavior at all? Would there be any need to? For instance, if you can't communicate your needs and wants, you really have two choices in front of you. You can either become extremely passive and just let life happen to you, or you can kick up quite a fuss because you can't get your needs and wants met. You don't have a way to do it. And so we know that a great deal of the time, the literature already tells us, the science already tells us that a great deal of the time, if you focus on alternatives to problem behavior, I mean, really seriously, you can reduce problem behavior significantly. However, as soon as we say that, is it likely that with some individuals, a small set of individuals, that some punishment procedures might still be required? The answer is yes. But can you do it a substantial portion of the time with largely little to no punishment? The answer is almost certainly yes. But it doesn't mean all times. Are there some individuals with such extraordinary forms and complex reasons that punishment might be required as a safety measure? Yes, there are.
The concept of neurodiversity has become a popularized way of looking at the concept of disability. Neurodiversity proponents advocate for accommodations of behavior of those who are neurodivergent rather than intervening or trying to change behavior. What do you think of that?
Yes, there's a couple of gentlemen in the United Kingdom that have established a little curriculum, and they're very much in that way of thinking. And I am to some extent as well. There are certain things that they are so difficult to change and would require such time and energy and skill and financial resources and effort that it's probably just better to accommodate them. It's probably just better to accommodate that issue with the individual and try to change it. Where we would try to change behavior is if you're going to be out there in the community and there are certain things you just can't avoid. If you want to give a person a certain amount of independence, they're going to have to wait in line. You know, they're going to have to make choices. They're going to have to experience disappointments. And so if we expect them to be out in the community with limited supervision, then we're going to teach those things because they really can't do that and be successful. However, are there some individuals that we would also allow them to have accommodations? Yes, absolutely.
The Essential for Living is specifically geared towards those with more severe disabilities. When a higher functioning individual doesn't learn concepts such as accepting no, and I know this is one of the essential 8,
Yes.
Are they not also at risk for developing these problem behaviors?
Yes, they are. Are certain of the essential 8, do they apply only to people with severe disabilities? Oh, absolutely not. They apply to the whole lot of the non-disabled population.
Okay,
You know,
so
sure.
For a neurotypical child, if they don't eventually learn to accept no, they're also at risk at developing these behaviors that we're talking about.
Oh, without doubt they are. Absolutely they are. Mm-hmm.
Okay.
Sure.
Very nice. As you know, second-generation antipsychotics, risperidone and aripiprazole, that's Risperdal and Abilify. They're
Yep.
FDA approved for the purpose of reducing agitation in those diagnosed with autism. These medicines are also used off-label with other disabilities as well. When an individual presents problem behaviors, When would you recommend Essential for Living curriculum and the Essential 8 versus a referral to a psychiatrist to receive medical intervention?
Well, the interesting thing about your question is they were off-label for autism at one time. Those medications weren't even approved for autism at one time, you know, and they only became, they were off-label for autism for a while. Where we would place antipsychotics, anticonvulsants, other classes of medication that are often used with really severe problem behavior is, we would say this: we would rather get as much accomplished without them as we possibly can, and only save them for circumstances where the person is, where you're up against it. Either you take a person and clamp their hands down so that they can't move them, or you give them some medication. Which are the two? You cannot stop them from hitting their own head. You see what I mean? And so you get into a dilemma there, and then, you know, it can be very difficult. We would rather not use those. We use those only when behavioral or other types of intervention are not effective, and not go to them right away. They would not be our first choice. Now, however, if somebody, I mean, I closed my clinic, so I don't have my clinic anymore, but if somebody walked into my clinic and it's a pretty good sized person and they're fisting themselves in the eye and mom and dad are basically just blocking it, right? And you know, and we talk about what some of the various interventions could be, and it would require quite a bit of interviewing and testing and so forth. But would I send them to the psychiatrist right away? No. Unless they're going to leave my office and go back home and they don't have anybody to help them. In which case they have nothing. They have nothing. Then I would say, let's do this. Let's have an appointment with a psychiatrist, get a modest dosage, but then let's put a behavioral program in place, try to change the behavior and gradually fade the medication. Now, if it wasn't immediately dangerous, I'd start the program without the medication at all. And the medication would be the backup, would be the plan if things, despite our best efforts, didn't go well in the intervention. Because you got to have something. You can't sit there and, you know, people have to have some option. But the problem is that you know, over the years before behavior analysis became reasonably popular, that was common, and people were in large hospital settings, and I've seen people in hospital settings for 30 some odd years, and you see people with 4, 5, and 6 psychotropic medications all at once. And it used to be quite common, still is in some places. And
I know plenty of people who,
yeah, it's just awful. And it's just a horrible waste of a life, waste of what a life could be. And so we would only go there if you felt like it was literally at the moment the only reasonable option you had. The same way with restraint. It's the same issue with restraint. The only way you'd go to that is if it's the only reasonable option that you have, and you have to keep people safe. You want them safe. And that's your first obligation. And if it's the only reasonable way to keep them safe, then at the moment, but not necessarily for life, that's what you may have to do.
What advice would you give families whose loved one is displaying severe problem behavior?
Well, the first thing you really need is a competent professional. Now, here's the problem we're experiencing in the field of behavior analysis. Because it has paired itself with autism and it has mushroomed in terms of the number of people. Certification programs are all over the place. Probably 3,000 to 4,000 to 5,000 people are being certified every year. I remember when I first started in the field, which is even more than 30 years ago, I mean, there was almost nobody. There wasn't even such a thing as a behavior analyst. Nobody called us that. We were behaviorally oriented sort of people, but there wasn't such a thing. And when you had a problem kid, there maybe were 3 people in the country you could call for advice, because there was nobody around. There wasn't hardly anybody here to ask advice from.
I remember that.
But now we have people out there who, now we have people who are certified. They've been certified and they've been out there for 2 or 3 or 4 years, and they've been shuffling laminated cards around a table with a little kid with autism. And then all of a sudden somebody puts somebody in the room who's slamming their head off the wall. That's not a person who's ready to deal with that.
Absolutely.
You can't learn how to deal with that in your first case by yourself. I'm convinced in this era you can't. Because you cannot learn how to deal with that when that's your first case and you're by yourself. You can't. So what do parents need? They need somebody who will tell them honestly, I have experience with this. I know how to do this. The sort of colloquial way to say it is, this is not my first rodeo, not even close. That's what you need. And if it's somebody's first rodeo, I'd look the other way. Keep looking.
Well, often the help that's out there and in the schools, even if you're in a specialty school, and certainly if your kid is an adult in rehabilitation, you're not going to get that kind of expertise that you're talking about. Yeah, I think you have to go private for that.
I think you do too. I think unfortunately you do. Now, if you can, what I always advise people, if you're in a program, and try to get the program to hire the person as a consultant. And then maybe what they can do is help your child and help somebody else in the program. Well, some programs won't do that.
It's very difficult. Very difficult to get them to get that.
I know it is. But
in a way, it's almost easier to work with the disabled individual who is having the difficulty, work on having them learn all those adaptive skills in the Essential 8. And sometimes it's easier to work on helping your child obtain those skills than it is to get somebody in a program to realize that they need more help than what they normally offer. You know,
well, that was our intention with the Essential 8, is that even if you didn't know much about changing problem behavior, if you taught the Essential 8, it was your best antidote. It was your best way to approach it if you didn't have experience or sophistication with managing problem behavior.
Now, just for our viewers, could you briefly go over the Essential 8 so
Sure.
they know what we're talking about?
Sure. The first one is getting your needs and wants met. And people in the field of verbal behavior call that a MAND, M-A-N-D. But that's a Skinner term, and it isn't necessary. It means, can you make requests? Can you ask for things and people and places and things you want? That's number one. Number two is, after you make a request, can you wait when it's not honored right away? You have to be able to wait. Number three is, can you share? Can you transition? Can you take turns? In other words, when you don't get what you want right away, but you are going to get it, can you handle that? Four is, if someone asks you to do something you already know how to do you do it? Not necessarily every time, but most of the time. If somebody asks you, take your dishes and put them in the dishwasher, and you already know how to do that, so all it is a matter of following an instruction, do you do it? Number five is accepting no. That requires no explanation. Everybody knows what that is. Number six is Can you follow directions related to health and safety? So if I say, come here, wait right here, take my arm, hold my hand, keep your seatbelt on. Do you follow directions? Put the knife down. Do you follow directions that keep you healthy and safe? That's number 6. Number 7 is, do you exhibit daily living skills? Like, do you brush your teeth? Do you eat proper foods? Do you wear proper clothing? Do you take your necessary medication? I don't mean your psychoactive medication, but any other medication you might need to take. Do you do things that keep you healthy and safe? And the last one, number 8, is, do you tolerate things that keep you healthy and safe? Okay? Can you tolerate changes in your daily schedule? Can you tolerate physical touch and guidance so somebody can help you learn something? You see? Or do you just want nobody to touch you? Can you tolerate all the different kinds of things that would occur in your day? Can you tolerate adaptive equipment you might have to wear, like ankle-foot orthotics or something like that? Can you tolerate those? You see? You know, can you, I mean, like in today of COVID, can you tolerate a mask? A lot of our kids have to wear masks now. Most of them would. Can you tolerate a mask? You see? And so that's your essential 8.
My son has troubles with tolerating a mask. He's coming to visit me next week, and I'm going to be working on that. So what is the latest research on ways to help individuals with severe disabilities? Is there anything you'd like to say to update our families and professionals that might be watching today?
I think one of the newest things that's exciting is the change in how functional assessments are conducted in behavior analysis. That's very exciting. That is largely the work of Dr. Greg Hanley and his students and his colleagues. And it is a much more thorough, comprehensive way to do assessments on problem behavior such that treatment and intervention is more directed, it's less aversive, and more comprehensive. I think that's important. And I think the other thing I think is the beginnings of, people are beginning, I think, and this is partly opinion on my, people are beginning, for a while in this country, we accepted the notion of full inclusion because it sounded like a good idea. It sounded like all the children with handicaps, no matter how severe, should be in the same room educated with people without disabilities. But we're discovering that, as enticing a notion as that is, it does a grave disservice to the children with the handicaps, because they're sitting in a history lesson that many of them don't understand. And even if they did understand it, would it have any impact on their life at all? Would it do anything? And so I'm encouraged that more and more people are beginning to think that we went probably a little bit overboard on that thing, and we need to pull back a little bit, and that people should be included when inclusion benefits the people, not just the thing because we all think it's a great idea. You know, it's being included when it benefits you to be included, when it helps you do things, it helps you learn things. But I remember, this is several years ago, I went to a high school classroom. This when I was still consulting, and I was there to see 2 boys who were new students, high school class in a public school, and they were both self-injurious guys, and they were brand new to the school district. And the teacher was having a bit of difficulty with them, as one might guess. And I had been in this lady's classroom before, and she was quite a good teacher. I was quite impressed with her. Very, very dedicated and very, very skillful. But she had never had self-injurious individuals before. So I walked in this afternoon, one afternoon, to see those kids. Well, she was finishing up a lesson in the front. And the lesson was what the district had told her she was supposed to teach, because it was part of what in Florida would have been similar to the Common Core state standards. Got to teach an academic skill. So she's teaching it. And the lesson is on the Red Cross. Now, the two kids that were new to the room were back in the back of the room just stemming their socks off. I mean, they were just having a great time just playing. They had no idea what she was talking about. Most of the other kids were either put their heads down or something. They had no idea what was going on either. John, one of the young men in the room, whom I'd gotten to know over the years, he raised his hand. And he kept raising it, and she tried to discourage him from raising it because she wanted to finish the lesson. And finally, he wouldn't stop, so she said, "John, do you have something to contribute?" And he said, "Teacher, I know the Red Cross. It's just like Jesus." That's what he said. Now you can see the connection he made. That's not difficult in this culture to see Red Cross Jesus. Come on. That connection could be made easily. But it also means he doesn't really understand what's going on in that lesson. And he was one of the highest functioning kids in the room. And he didn't understand what that lesson was.
Right. Well, I would like to see something like the Essential 8 actually being the core curriculum for people with severe disabilities. From what I've seen, I haven't seen anything that would be beneficial to my son in terms of standardized curriculum and testing. Nothing.
More and more people are realizing that. We linked ourselves to the Common Core and to a couple of the state achievement tests so that people that feel like they're legally obliged to relate to those standards can still teach our skills. And so that's important. And then occasionally we have a really brave director of special education who's willing to look the other way, frankly, and look the other way and just say, listen, they can come after me. They can come after me and, and try to, say that I'm not doing the right thing. But if they'll spend 10 minutes and sit with these kids in the classroom, doesn't take an hour, just take 10 minutes. And you sit in that classroom and you tell me that a history with Abraham Lincoln will help them in their lives and is relevant for them. And if you'll say that it is, my suggestion is you probably nod it off during the observation, because I don't know how you could possibly conclude that. Kids who can't get their needs met, who can't navigate the basics of everyday living, and somebody's asking them to sit through a history or a science lesson just makes no sense.
So is there anything else you'd like to say to our viewers today?
Well, the topic that you touched on earlier is intriguing to me, and that's the neurodiversity. That topic is intriguing to me. And what I want to do is interact more with the people who have strong feelings about that, because I think that's relevant at times. For sure it is, very much so. And I'd look forward to the discussions that maybe we could have on that issue itself.
Okay. All right. Dr. Patrick McGreevy, behaviorist and first author of the Essential for Living Assessment and Curriculum. Thank you for appearing on my YouTube channel. It's been a pleasure.
Thank you, as it has for me.
To find out more about the Essential for Living curriculum and the Essential 8, I have some links below. If you have a loved one who's enrolled in a rehabilitation facility in Massachusetts, or you're thinking about rehabilitation for your loved one, please consider joining the Rehabilitation Families in Massachusetts Facebook group. Also, please consider buying my book, Avi and Arlene's Autism War. Thank you for watching, and I'll see you on the next video.